Turning to the health dental plan, which is one of the operations that we administer, it is about a $60 million plan, just under $60 million in terms of receipts coming in and claims paying out. For 8 straight years, we were below trend. What trend is a combination of inflation, the cost of health care, and utilization. When you think of and you hear about health care going up 6, 8, 10, 12% a year, that's a combination of inflation, the cost of health care, but it also includes, in fact, 2/3 of that number is utilization. We as Americans are consuming significantly more health care, more scripts, more trips to the doctors, more tests, more operations. So when you think about the cost of health care exceeding the cost of the consumer price index, it really is components of not only inflation, but our utilization of health care. In spite of that, in the aging of our churches, we were below trend, in fact, nearly half trend for 8 consecutive years. And that is primarily a result of our members using networks in the healthcare plan. They used networks instead of out-of-network. They use generics as a substitution for brand drugs. And because of coalitions, we have coalitions that cross denominationals. There's 18 different denominations that collectively come together and purchase prescription drugs, 11 denominations that come together and collectively purchase medical care. And to know the importance of leveraging the purchasing power of the entire church to get better outcomes has allowed us, as expensive as health care is, to increase at about half trend for 8 consecutive years. As we moved into 2011, that stopped. We had significant increases in large claims that caused us to have an increase at trend. Our 2000 rates, when they were published, 12% non-Medicare, that is our active population, 5.2% Medicare. That was just about trend. But subsequent to announcing the rates, and what is in the mail for this quarter of 2011 is a 1-month premium holiday or 1-month premium credit for the active side of the church. That's about $3 million reduction in health care premium that our churches have to pay. That is like $3 million of found money for local churches because it does not need to be paid in health care premium. And that was not a result of underwriting. That was a result of investment performance because we hold reserves in the health plan to pay future claims, and we had significant investment outperformance in the last 120 days of last year that allowed us to give some of that back this year. So the net effect is we were below trend, again, in effect this year, although our rates are at a rate that increased that 11%. We do have a very active health wellness program and an adherence program, adherence meaning to incent and urge folk to comply with their drug treatments and other things. And that is operated under the logo of ucchealthystewards.org. Healthy, you see, kind of ties into our vision statement. You get that? And so that's what we operate. Then we have about 1,000 folk that are participating in our adherence program, getting support for adhering to their drug treatment plans and their medical regimen. And about 500 are participating in our wellness program that is in a direct way receiving a financial incentive to do better with respect to their own wellness. 2 years ago, we did a review of the Medicare supplementation plan. That is the plan that's in effect for our retirees. We affirmed the plan that we have in place, and this year we will launch another review of that plan consistent with what is occurring in the healthcare reform law. So we'll be starting that up again this year and reporting out on that next year. This is a very busy slide, but to get some numbers, this would be our Medco numbers, and just to draw your attention to these kind of numbers right up here, you'll see calendar year 2010, AWP is average wholesale price. So if we were just in the marketplace to buy prescription drugs for our member base at wholesale, that price would be over $34 million. You heard me refer to our coalition, which has 18 different denominations, about 170,000 covered lives or employees, about 350,000 belly buttons. So this larger group, contrast that with our member base. We go to market to negotiate our drugs, And we get a discount that is quite significant because of that coalition. That is an example of the whole church working together to get significant reductions in cost, and that's just on the pharmacy side, if you would note that. And then if you would note this down on this line, this 38.8%, that is the net effect of a discount, not only because of our purchasing arrangement, but because our members use generics. They substitute generics at a very high rate over brand names, and mail order, which is an efficient way of receiving drugs, much more inexpensive than retail. Because of that, that actually drives our net effect in terms of cost for the pharmacy part of what we do. And that, again, is really the members of the church claiming ownership of incentives that helps the members save money, but also the plan to save money as well. Similarly, our contract with Highmark Blue Cross Blue Shield has 11 denominations. This over here is the Southern Baptist Convention. So some of the folks that we are in partnership to get better outcomes may have different points of view about what we might think about in other parts of the church. Guidestone Financial Service, Southern Baptist, this is the Board of Pension. The Presbyterian Church USA, we're number 3 in the group in terms of size. But you'll see, again, in terms of the percentage savings, that we are able to achieve because we have 110,000 households working together to get a better outcome on the medical, about 200,000 covered lives. The effect there, if you come down here, you see UCC, is $28 million. So when you see, and you've heard reported, half trend over a long period of time, how we are achieving that in many ways is a result of our coalitions coming together to drive better and better outcomes. And to the extent that God's whole church were to come together, we could dramatically reduce the effect on these last two, this slide and the previous one, even more. So that's a way of the church working together with church in a variety of ways on the business side of what we do can free up more money for mission. The collective, and we've done this, working together about 10 years in these coalitions, and we tried to aggregate how much has the church saved in pharmacy and medical spend because of these coalitions over the 10 years, and it's approaching $300 million. $300 million has been saved by the church that has gone back into our respective denominational entities that could be used for mission or other things. It is really quite dramatic and quite significant. A couple of things that are embedded in our plan that you don't know about, those that are part of our health plan, are there's a look to make sure we don't have drug interactions, and it's called Rational Med. We get about 200 to 250 alerts a year are fired off from Medco to a local doctor that really has discovered a drug interaction. Some of these are life-threatening. We project 2 to 3 lives per year are saved because it could be so dramatic. But behind the scenes, in terms of how the plan's administered, and here's just a couple of examples. One with a young person, a 24-year-old, again prescribed the drug, and that you could have liver failure, and we caught that. The drug was stopped before the prescription was filled. And again, for an older patient, 66-year-old, again, a drug that was prescribed, and again, you could have a significant increase in suicide with a drug interaction there. But again, 200 to 250 of these alerts are fired off each year to doctors behind the scenes. This is healthcare reform. It is complicated. It lays out over a 10-year period. The healthcare reform law was voted in March of 2010, and there are sets of compliance dynamics that occur between 2010 to 2018. The slide is just to report that we have elected to be a grandfathered plan, and there is a certain requirement as it relates to being a grandfathered plan with respect to the healthcare reform law. And we are in full compliance going down this timeline in terms of healthcare reform. One element of that in 2010, last year, to be compliant on 1/1/2011 was to provide medical services to up to age 26, dependents to 26. Our board voted to actually be compliant 6 months early, and we were compliant as of July of last year with that aspect of the law. So again, to know that we are on it. Healthcare reform, you hear about it. It is evolving. The regs are being written as we go, but we are on top of all that is required with respect to healthcare reform.